Good afternoon, everyone. We'll begin in just a few moments. Before we get started, I want to do a quick audio check with our panel. Can you all hear me okay?
Yep.
Yes.
Can you all hear me? This is John.
Yes, we can.
Great. Started.
Good afternoon, everyone. We're just giving it one more moment to get our panelists in. Good afternoon, everyone, and welcome to the Wednesday, December 16th, COVID-19 update media briefing. I'd like to welcome our panel, which includes Dr. John Weisman, Secretary of Health, the Washington State Department of Health, Dr. Kathy Lofi, State Health Officer, the Department of Health, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, the Department of Health, Michelle Roberts, Acting Assistant Secretary, Washington State Department of Health, Dr. Teresa Fotinos, Deputy Chief Medical Officer, Healthcare Authority, and Dr. Kara Mosseth, Behavioral Health Strike Team Co-Lead, Department of Health. We'll begin with remarks from Secretary of Health, Dr. John Weisman.
Good afternoon, everyone. Thanks, Corey. This is really a very exciting week in the COVID-19 response nationally, as well as here in Washington State, with the arrival of a COVID-19 vaccine and the beginning of getting people vaccinated. The development of a safe and effective vaccine has been faster than we could have imagined earlier this year. And I really hope that we can all take the progress we've seen on vaccination this week as a reassuring sign that the challenges we face will not last forever. Vaccines are a critical tool for controlling the spread of COVID-19, but they are far from our only tool. And even as we begin to vaccinate people in our state, it will still be important to maintain the infection control measures that have become part of our daily lives. And we'll also need to continue limiting our social interactions with people who don't live with us for the time being. And even after the pandemic is over, it will still be important to wash or sanitize our hands frequently and stay home if we're sick, just because that's good hygiene practices. Now, together, all of these tools certainly make up for a strong disease prevention strategy. We know the steps we've already been taking are effective for reducing the spread of COVID-19. And in a minute, you'll hear from Kathy on the current trends in the data where we are seeing some early signs of progress towards moving to flatten the curve. Now, we are not out of the woods yet because disease activity has been so high this fall. We don't just need to flatten the curve, we actually need to bend it down and lower the level of transmission. We are still seeing new daily case numbers that are far higher than our previous peaks in the spring and summer, and our hospital system is still very strained. We must stay the course in order to get this surge under control. I'd like to know that this is the last weekly briefing that Kathy and I will attend. Dr. Umair Shah is starting as our new Secretary of Health next week and will be joining these briefings in the future. As I said during last month's announcement, I've worked with Dr. Shah for over a decade and strongly encouraged him to apply for this position. I'm confident I'm leaving the department and our state's COVID response in good hands. And again, I really want to thank Dr. Kathy Lofi for all of her leadership. She's assumed a critical role in addressing every major priority the department has taken on in the last several years, and our state has benefited greatly from her guidance and her dedication to improving the health of all Washingtonians. Dr. Scott Lindquist, our Deputy Health Officer and State Infectious Disease Epidemiologist, is attending today's briefing and will give the epidemiology overview at these weekly briefings in the foreseeable future. Finally, everyone in our state has made difficult choices and sacrifices this year. I'm incredibly thankful for all your efforts to protect your families and our community's health. Please keep up the good work. We will need that to make it through these winter months. And with that, I'll turn it back over to you, Corey.
Thank you, John. Next, we'll go to Dr. Kathy Lofi, State Health Officer.
Thanks, Corey, and good afternoon, everyone. I'm just going to take just a few seconds here to pull up my slides. Great. So as usual, I am going to take a few minutes to walk you through some of the data that we have been seeing so that you all can understand kind of where we are in the pandemic. So this first slide shows the number of confirmed COVID-19 cases by their date of illness onset. And I want you to notice on this slide is that COVID-19 cases remain very high. You can see the case counts that are coming in every day are quite a bit higher than they were in the spring and during the summer. But I do also want you to appreciate that it does appear that we are having some success in flattening the curve. As I've explained before, these gray bars do not represent full data, but we are pretty confident at this point these gray bars will not get up to this level or the same trajectory that we were on prior to Thanksgiving. The second graph looks at COVID-19 hospitalizations over time. And again, if you look at this region of the graph, we are starting to see a little bit of flattening of this graph. Again, I see that as very a positive signal in our data. This third graph, unfortunately, shows that COVID-19 deaths continue to increase. And while this is very unfortunate, this finding is somewhat expected. As I've explained previously, our death data are more delayed than our case data and our hospitalization data. So we generally see cases increased first, followed by hospitalizations, and then deaths. So some other good, some positive signal in our data is that our COVID-19 hospital bed occupancy appears to be more stable over the past week than it had been previously, particularly throughout November. you'll notice that hospital bed occupancy with confirmed and suspected COVID-19 patients is still very high, but we have seen a stabilization in this particular data point over the past week, which is good news. These next 4 graphs show the same data, which are COVID-19 hospital bed occupancy graphs in different regions of the state. So the graph on the top left shows hospital bed occupancy with COVID-19 patients in King County. That does continue to increase, but at a slower rate than it previously had been increasing. In Southwest Washington, we've actually seen a decline in COVID-19 hospital bed occupancy. One of the areas of the state that I'm particularly concerned about now is Central Washington. You can see both in North Central Washington and South Central Washington, we are seeing a very dramatic increase in COVID-19 hospital bed occupancy, and it does not appear to be slowing much. The last graph I want to show you represents COVID-19 ICU bed occupancy. This data point also remains high, but it does look over the past week or two that it may have declined a little bit. Again, another positive signal in our data. So in summary, COVID-19 activity remains very high in Washington, but we are starting to flatten the curve, which is really good news. To date, we have not detected a post-Thanksgiving surge. COVID-19 hospital bed occupancy remains high, but appears to be more stable than it was in November and earlier in December. And COVID-19 ICU bed occupancy looks slightly improved. I want to remind people that hospitals do continue to cancel some non-urgent surgeries, so they are not back to their normal operations yet due to a high number of COVID patients in the hospital. So it's important that we stay the course and we don't let down our guard. If we were to have another surge in COVID-19 activity at our current level of disease, which is very high, it would result in more hospitalizations and deaths and would very likely overwhelm our hospitals. So in summary, we're in sort of a precarious position right now. We're seeing some positive signals and all of the changes that people have made to their lives and all the sacrifices that they have made have really paid off, but we're not done yet. We need to continue to avoid gathering indoors with people outside of our household. We need to continue wearing our face masks, and we need to continue staying 6 feet away from other people. At least for the next few months, because COVID-19 transmission is going to continue to be difficult to control during the rest of the winter. I wanted to make one other announcement before I turn it back over to Corey. In the past, I have shared with you all data from persons in Washington who have tested positive for COVID-19 using an antigen test. We have been publishing that data in a separate report on our website, and I'm happy to announce today that we will be adding those positive test results into our dashboards. So you will see a slight increase in case counts and case rates. I think the last thing I just wanted to mention about that is the 8 persons who have tested positive using an antigen test has been a small portion, about 5% of all of the people in Washington who have tested positive for COVID through a laboratory test. So you'll see some slight changes, but nothing too dramatic on our graphs. As Dr. Weissman mentioned, this will be my last press conference, and he also mentioned that Dr. Scott Lindquist will be presenting the data moving forward. Dr. Lindquist is an infectious disease physician and a public health expert, and so happy that he will be able to continue this role that I have been playing. And Scott will be on to answer questions. I unfortunately need to leave the press conference a little bit early today, but Scott will be available to answer data questions if you have any data questions. And with that, I'll turn it back over to you, Corey.
Thank you, Dr. Next, we'll have Michelle.
Good afternoon, everybody. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. As Dr. Wiesman said, this is a very exciting week for us with the first doses of COVID-19 vaccine arriving in Washington. The FDA's decision to authorize the use of a COVID-19 vaccine is an incredible milestone in the pandemic. In addition, the process followed by the FDA and CDC to make these decisions has been open, transparent, and scientifically rigorous. The reasons the vaccines were able to be developed so quickly is because of existing research that they started from, and because production of the vaccines happened in parallel with the clinical trials, which really allowed us as a nation to roll the vaccines out right after they were authorized by the FDA. About 31,000 doses of COVID-19 vaccine are already here in the state, and we anticipate about the rest of our allocation, another 31,000 doses being delivered later this week. The first doses are going to high-risk workers in healthcare settings and patients and residents of long-term care facilities. Vaccination started yesterday, and I'm excited to share that 410 doses have been reported to our state immunization information system already as of late this morning. Vaccine will be delivered to a total of 39 sites in 29 counties this week and to 3 tribes or urban Indian health programs. As of yesterday, we've had 272 clinics, pharmacies, and hospitals fully enrolled in our COVID-19 vaccine distribution program. These locations currently cover 37 out of our 39 counties in Washington. Now let's talk about the next vaccine candidate, the Moderna vaccine. Moderna submitted an emergency use authorization on November 30th. Tomorrow, the FDA is scheduled to review that application with their independent advisory committee. If the FDA approves the vaccine, then the vaccine will be reviewed by the Scientific Safety Review Work Group as part of the Western State Pact, the same process that the Pfizer vaccine just went through. If approved by the work group, we expect to get over 180,000 doses of the Moderna vaccine by the end of December. Having vaccines from both Pfizer and Moderna will speed up our efforts to vaccinate people in the next several months. But right now, our effort to vaccinate the people of Washington has just begun. We are glad there was a lot of interest and high demand so far. It will take several months to get everyone vaccinated who will want the vaccine, but we can see a light at the end of the tunnel. It's important to keep doing our part to slow the spread of COVID-19. Please continue to social distance, wear a mask, wash your hands, and keep your gatherings small. And don't forget to get your flu shot. Thank you.
Thank you, Michelle. Final remarks for this portion of the briefing come from Dr. Kira Monson.
Thanks, Corey. Hi, everybody. Good afternoon. I'm here to just share a little bit about where we are from a behavioral health perspective at this point. And as you know, 9 months into the pandemic, we are solidly in what's called the disillusionment phase of recovery and response. So that comes with it a lot of exhaustion, and the exhaustion tends to manifest at this time, especially around this time of year, into what we're calling pandemic apathy. So that's a really distinct feeling of just not really caring about what's going on. And it's sort of a clinical term to describe what is more commonly maybe referred to as just being really over it or being done with it, which is something that I hear quite a bit from students and clients and colleagues. Apathy can be really difficult to deal with, and it can affect our decision making. When we experience it, we often can't muster the energy to really care about something or to care as much about the consequences of our decisions. And that will change the choices that we make and how we prioritize stuff. So apathy can be pretty tricky to manage. And that's true also for kids and adults. So kids and youth are not immune to this experience of apathy either. Interestingly, we're kind of seeing pandemic apathy expressed both internally and externally. Acting in, so we've talked about that previously a little bit, is expressing distress internally. And acting out is that same kind of distress that's expressed in an outward way or an external way. So this way of looking at apathy focused internally is sort of just shutting down, not caring about much of anything at all, not wanting to really even try to participate in the holidays or the holiday experience or the spirit of the season, feeling really, really down. That can look a lot like symptoms of depression and hopelessness. So we really urge people to check in with friends, check in with loved ones, colleagues, family members. If you start to see signs of this internally expressed apathy about the pandemic, people just really not caring and shutting down, it can be really difficult. And for people who are struggling in that way, particularly young people and older adults, they need some extra support. So that's worth reaching out to folks. Pandemic apathy that is expressed externally, so that's outward-facing apathy, can look a lot like kind of rejecting or ignoring the fact that we're still in this fight, as you've heard today, that it's ongoing. People may want to refuse to comply with guidelines or just try to go about their day-to-day life and business as usual, as if we weren't in the pandemic, which obviously isn't the case. So fortunately, there are some things we can do to sort of address this apathy issue. The first thing is to just be aware of it, to have some insight around that that's affecting a lot of people right now. And then the second thing is to take a few minutes to consider how or if apathy is affecting your decision-making and your overall well-being, or if any of these experiences that I've sort of described are happening to you or to other people in your life. Check in with yourself. Take a moment before you make a decision and do something in terms of an interaction with someone or a behavior. Take a breath, take just a pause before you respond. If you struggle with the acting in part, so shutting down and feeling like you just don't care about much of anything right now, try to look for really small, simple things to do, something that's different outside of your normal routine. Identifying things that you do care about, maybe a family member or caring for a pet, that's a helpful one. And then focusing on what keeps us connected to other people and things outside of us. That's bigger than any of us individually, and that can help reduce that. And finally, the arrival of vaccines obviously brings with it a great deal of hope, and hope is great. Hope is one of those key ingredients for resilience, and it's a powerful one. It can be a great antidote for apathy as well. And you've heard today repeatedly, it won't stay this way. This isn't going to be forever, and things will feel better in the future. So that has to be in the back of your mind. I will close by encouraging everybody to take a look on our website at the coping resources that we have, and that is coronavirus.wa.gov/wellbeing. We also have a new Coping with COVID podcast series that's on that same site. Check it out, see what works for you. And then remember, if you are having some of these concerns, it's incredibly common right now. If you're worried about yourself or someone else in your life, check in, ask for help, and don't hesitate to reach out to a primary care doctor or a pediatrician for some extra support if that's what's needed right now. That is it for me. Thanks, Corey.
Thank you, Dr. Mathis. Next, we'll go into the media Q&A of today's briefing. With that, if we're not able to get to everyone in line, just know we'll follow up separately by email. We do have a number of reporters, but we'll be offering follow-up questions during today's briefing. So,
hey, Corey, if I might, this is John, if I might.
John, go ahead.
Can I just also make another comment, too? Based on Kathy's report, we're pleased that we seem to be bending the curve, and yet we've not yet plateaued. I want to just also really re-emphasize that for the holidays here, it is incredibly important that people do not gather socially. That, again, we have a prohibition essentially on household social pieces just being within your household. We're going to need to continue to do the virtual events that folks did over the Thanksgiving holiday in terms of having, dinner virtually through sharing of your video cameras, Zoom meetings, whatever it might be, and celebrating with people that way. And if we're socializing at all, doing so outdoors with masks on, staying our 6 feet of distance away and going for a walk or something like that. But we're still at a very precarious time, and the efforts that we believe many people took over Thanksgiving need to continue throughout this month. So we know that the holidays are a time where folks often gather and in our homes, and that's just simply continues not to be safe at this time of the year. So stay connected, though. As Kira mentioned, it's important to be connected to the people we care about and our families. We're going to just need to do that through our virtual ways that we have talked about before. And certainly, if we're connecting with someone socially outdoors and distanced and masked up for short periods of time is the order of the day. And we really appreciate everything folks are doing along those lines. Thanks.
Well said. Thank you, Dr. Weissman. So we'll jump into media Q&A. Our first question comes from Ariel Dreher with the Spokesman Radio.
Great, thank you. I believe my first question is for Michelle. I'm curious if the state is monitoring which long-term care facilities and adult family homes have not signed up through the federal vaccine program, and if those workers and residents will still be included in phase 1A regardless for vaccines.
Yeah, great question. So we are definitely, sorry, quick 12-year-old interruption. We are definitely monitoring and working with the list of long-term care facilities who have signed up for the federal pharmacy program. And we believe that is about half of the total facilities in our state. We can follow up with more information on specifics. But yes, we are looking at that list and constantly refining that list with CDC. And all the other facilities who are not participating, who did not opt into the federal partnership, which means that CVS and Walgreens will be delivering the vaccines for those who opted in. The other facilities, we will be working to ensure they have vaccine, and we are gathering information from them on what other pharmacies or other ways they want to receive that vaccine, make sure we can get vaccine to the right places so all long-term care facilities in our state will have access to vaccine for their staff and residents.
Great, thank you. My follow-up is probably for Secretary Weissman on what he just mentioned for holidays needing to look different. Do we have projections or data for what our hospital capacity looks like if people stay home for Christmas versus if they do not?
So as Dr. Lofi said earlier in this, the hospital capacity is still very full. Our ICUs are very full. And it is especially our ICUs that are sort of the first at risk in terms of being able to staff those. And we do have on our dashboards the percent of folks who are, or the percent of hospital beds, for example, that are full. But if you remember back to her graph, all across the state, essentially hospitals are very full with COVID patients, and the largest number of COVID patients we've ever seen in this. And the important piece to that is that is true all the way across every region at the same time. In the past, not all regions have surged at the same time, and certainly not to this level. So we're very concerned, and a surge on top of where we are right now will very, very quickly overwhelm our hospitals. Right now, just under 80% of the staffed acute care beds are full right now in our hospitals. And again, part of the way they have built that capacity is by stopping a lot of the non-urgent procedures that they've been doing, which means that procedures that folks have been waiting for, it could be heart valve replacement, it could be some cancer surgeries, knee, hip replacements, that those are getting postponed. So we're still at a very, very precarious time for our hospital capacity, which is why it's so important that everybody continue these prevention measures throughout the holiday season.
Our next question comes from Anna Boyko-Wayward with KUOW.
Hi there, Anna Boyko-Wayward with KUOW here. Question for Michelle. We had a listener who is a senior with what she says is high-risk comorbidity, she contacted us and she asked the following question. How/where do people register for the COVID-19 vaccine? If you were talking to her directly, what would you tell her?
Yeah, great question. I think one of the first things is that right now we know who is in line for the vaccine at the moment, and that is the high-risk workers in healthcare settings, high-risk first responders, and residents and staff of long-term care facilities. We still need to make decisions about who's coming next and in what order. We have information we've gathered from community input, from the National Academy of Medicine framework on equitable distribution of COVID vaccine. And we're waiting for one last piece of federal guidance, which is from the Advisory Committee on Immunization Practices, which is a CDC advisory committee. We expect them this weekend that they will make a decision on and vote on recommendations of what the phase 1, B, and C groups are. And then next week, we'll be able to use that into kind of further our decision making and be able to share information out about who will be next. We don't anticipate kind of expanding beyond these 1A groups until mid-January at the earliest, but that depends on a few different factors, including what the uptake of vaccine is by the 1A group, and also what ongoing supply is after January 1st. We don't have that information from the federal government on ongoing supply. We have been told we will get weekly shipments and we will get enough definitely for all the second doses for the people who are getting first doses, but we do not know the amounts of additional vaccine we will be getting. So I guess the bottom line is hang tight, more information to come within the next few weeks to answer that question.
And then, okay, so let's say I'm the listener and I'm like, okay, I get it. I'm hanging tight. Let's say it's my turn. Let's say we have enough doses. Let's say I'm in the next group. Is it a matter of signing up or, do I wait for the doctor's office to contact me?
Yeah, we're working on a number of tools, and we'll have information to share over the next couple of weeks about how you can assess where your place is in line and then be notified by the state when it's your turn and be linked to the places where vaccine is available. And we also do expect, especially for people who are high risk, maybe who are regularly seeing a physician or another healthcare provider for some kind of chronic condition or other high risk condition, that those healthcare providers will also be notifying people when it's their turn. So our goal is that everybody is going to have more than one way to find out that it's their turn in line and where they go to get vaccine. So those are all the systems we're working on putting in place over the next few weeks.
And just to clarify, you mentioned 410 doses reported to the system. That means that 410 doses have been injected into arms, right, of the Pfizer vaccine?
That means a minimum of 410 doses of the Pfizer vaccine. So all these healthcare providers are recording as they give vaccine. All these facilities who have vaccine, they record it in their own systems, and then they report that to our system. So there can be up to like a 72-hour delay in getting that data, but it is a good sign that vaccines are being given, and at least 410 in our state, and that's the number that's already into the state system.
Our next question comes from Simone Del Rosario with Q13.
Thanks for taking our questions. We always appreciate these weekly briefings. Still have a lot of questions related to how these vaccines are getting to long-term care facilities and when. I understand, based on the information I've been given from DOH, it's taking a little bit for this federal program to get moving, maybe even a couple of weeks. I was told that in the interim, we'd be working with a local long-term care pharmacy to get into these facilities to be able to vaccinate these most vulnerable people. So when is the earliest vaccinations going to be at these long-term care facilities? Are we talking days? Are we still a week out? And what can you tell me about the complications of trying to serve this population?
Yeah, great question. So we believe, the best we know, that this first allocation, we did give doses to one pharmacy group that does serve a number of long-term care facilities across our state. They got 975 doses, and these are for long-term care facilities who did not opt in to the federal partnership with CVS and Walgreens. So they have told us they'll be able to begin vaccinating on Monday. As far as the long-term care organizations who've opted into the national partnership to get vaccines through CVS and Walgreens, there is a 2-week startup time to begin that program. So we have given that notification, and we also have to set aside vaccine doses to be able to start. So all of that is in process. We were able to set aside enough doses of next week's Pfizer allocation to be able to start that program on December 28th. And that is when, and CVS and Walgreens is working with all the individual long-term care organizations enrolled to schedule, to jointly plan and schedule when those visits will occur. They are focusing on the beginning with skilled nursing facilities, which is really the highest risk facility with people who are in that facility needing the highest level of care. And so vaccinations more broadly starting on December 28th. We'll be building fully to reach all long-term care facilities, throughout the month of January. So it does require some startup. You asked about some of the challenges, and really one of the planning purposes is really being ready to get necessary consent from residents. Some living in long-term care facilities are unable to give consent. So that means the facility will need to work with a family member or whoever is the authorized healthcare decision maker for that patient to give consent. So we're supporting, along with DSHS and the pharmacies, all the information that is needed for those facilities to be able to have those conversations and to be able to get that consent. So that is one of the planning pieces that is well underway, but definitely takes some time.
Thanks so much, Michelle. Clarify, are you giving out the name of that one pharmacy group? Do we know which long care facilities are not part of the federal program that will be able to get vaccinated starting on Monday? And then you talked about next week's Pfizer allocation. I just wanted to clarify those numbers with you as well. Was it 62,400 this week and then another 31,000 next week, or was it 31,000 this week and 31,000 next week, and then we're just anticipating more? I'm unclear on what the doses are that our state has received.
Yeah, thank you. So this week, it is 62,000 doses this week that we expect to be in the state. That is our initial allocation of the Pfizer vaccine. And so what I was sharing earlier is that 31,000 of those have already arrived, and we expect 31,000 to arrive later this week. So CDC let us know kind of over the weekend that they're staggering the delivery of all of the allocations in this first order. So that's why half of the 62,000 is here and half is still coming. And then as far as it, I don't have that level of detail. I think we can provide follow-up detail on what we know about the numbers of pharmacies in each program. And I don't know, the pharmacy chain is, like I said, is working with, who has vaccine this week, is working with long-term care across the state to schedule those visits. And I don't have the information about what facilities that are being scheduled. That piece is really between the pharmacy and each long-term care facility.
Our next question comes from Carla Johnson with the Associated Press.
Yes, thank you for taking my question. Well, the first shipments of the Moderna vaccine, assuming the FDA gives the green light, go to the same facilities that have received the Pfizer vaccine this week, or will you broaden that list? And on nursing homes, long-term care facilities, what do you know so far about the uptake among long-term care staff who are on the front lines and in Tier 1A? What are you hearing from facilities about what they expect their staff to do and whether they are experiencing some vaccine hesitancy or if they're expecting to take up the vaccine at high rates.
Yeah, great question. So the Moderna allocation for next week is much larger than what we got for Pfizer, assuming FDA does authorize the vaccine or give it the green light, as you said. So that vaccine, we will have over 120,000 doses. And yes, we will be able to get that vaccine much broader across the state. So to many more, definitely want to get vaccine into every county and to many more facilities. It's also just logistically a little bit easier as we get start making the decisions about finalizing our vaccine order for the Moderna vaccine. And the reason for that is because there's a 100-dose minimum versus the Pfizer vaccine that had the 975-dose minimum. So yeah, our goal is to get that vaccine to as many facilities across the state as we can next week. So, and the first step in making those decisions is looking at the list of providers who've enrolled in the program, that is who is eligible for some of that vaccine next week. So, and we'll be finalizing our order late this week for that vaccine. So really excited about the potential for the Moderna vaccine to help us reach many more people across the state. As far as what we know about vaccine uptake, and especially among long-term care staff, so just as in the community, we know that some people have questions and concerns about vaccine, and that is the same as residents and long-term care staff. So really what we're working on is ensuring that everybody who is in this group to be vaccinated has information on the benefits and possible side effects of this vaccine so they can make a decision about being vaccinated. And we're working on sharing that information with facilities, with DSHS, so they can share it, who license most of these facilities. We're working with the staffing unions and organizations of staff in these facilities, just really to make sure there is a lot of accurate, good information out there to help inform their decisions.
And I'm also interested in the name of that pharmacy that is working with the long-term care facilities in Washington State, if you're able to share that with us now or later by email.
Yeah, right now we're not releasing names of the exact pharmacies or any group that got vaccine, but we can definitely share I can share right now that pharmacy group did receive 975 doses in the first allocation. And that, once again, that they plan on vaccinating on Monday.
Our next question comes from Tom Bonsi with Public Radio.
Hi, thanks again for taking our questions. I think this goes to Secretary Wiesman, but maybe Michelle as well. Can you talk about how creatively or aggressively different industry associations and unions and other organizations are basically lobbying you to put their members in group 1B or 1C to be next in line for vaccination?
Well, I'll start and Michelle can add in. Obviously, we're getting a lot of interest in this and people who want to make sure, and industry groups who want to make sure that we know that what their risk is. So we are getting many, many emails to that effect, and we are collecting those. We are responding to those. We are appreciating the input they're giving us, and taking that information in very carefully. I would say that there's high interest in this, which is great. We are really hoping that people want to get the vaccine. We know it's going to take some time to get to everybody who would like it. So lots of contact with folks, which we are appreciating, and making sure we understand what those risks are too, as we continue to build out what the next phases will look like, so that we're assured that we're really thinking of every group that we need to be thinking of. Michelle, I don't know if there's anything you want to add to that.
Yeah, I'll just share again that, like I said earlier, we're really waiting for a vote from the Advisory Committee on Immunization Practices this weekend, because that will be the framework that will help guide our decision, in addition to the community input and the National Academy of Medicine framework. Also, we really need to know more about vaccine supply ongoing after January 1st, which is another piece that's going to help us understand how many doses and then how many people are in. We've got, population estimates that we're constantly working to refine of all these different groups, and that's going to help us refine those decisions. The last thing I'll say is we're also regularly sharing information with all these groups we're hearing from about kind of the criteria we're using to make these decisions. And that criteria includes that one of the goals with the vaccines is to help the vaccines we have right now, what we have limited supply, is to, one, help maintain our health system capacity, two, to protect those that are most vulnerable, and then to protect the workers that are highest risk. So those are kind of some of the principles we're using to help guide those decisions once we have all the information we need to make them.
Just a quick follow-up. How hard is it to decide, is a prison staffer more deserving than a flight attendant, than a teacher in a classroom, or so on? Do you feel torn when you read these messages that come in on your email?
Absolutely, we feel torn. There's limited vaccine, and we need to do the best decision making we can with the data we have and the values that are out there in terms of trying to assure equitable access, make sure that those who are most affected by this epidemic and those who are at highest risk for death and severe illness are getting all the due consideration that they need. We have many conversations about this internally and at the highest levels of our government with the governor, and hours of conversation around this and making sure we understand the data as the best that we can and estimate population sizes with the best information we have. So it is, these are difficult decisions. Wanting to do right by all people in our state. And we ask that people be patient. We ask that, there are other tools we have as well to keep ourselves safe in the meantime, while the vaccine is getting distributed and manufactured, produced. And it's really important that we all do our best to adhere to those public health prevention practices that we've been talking about. So yes, it's difficult. We appreciate people's patience and interest, and I really appreciate that people are interested in getting the vaccine.
Our next question comes from Tammy Matafa with Como.
Hi, good afternoon. Thank you so much for making time for us, as always. Mine was along the lines of the vaccine. What do we know about how long the vaccine's protection lasts? Like, can you still spread COVID-19 after you get the vaccine?
Yeah, great question. That is still an area we have a lot to learn. So we do not know how long the vaccine lasts. So that is a piece that will be ongoing from the clinical trials. All the clinical trials are continuing to collect information and look at look at the data from the people who participated in the trial to help answer that question. So we'll know a lot more over time about that. And what was the second half of your question? Oh, what about spread of the disease? What I can also say about it, and one of the reasons we really want to make sure everybody continues to wear masks, is that the clinical trials were really looked at efficacy of the vaccine. How well did the vaccine prevent against COVID disease when you have symptoms, so symptomatic COVID disease. It did not look at asymptomatic COVID disease, and it did not look at can you still be a carrier of the disease after vaccinated, after you were vaccinated, and still transmit to others. So those are some of the ongoing research we need about these vaccines and data, and that is why we continue, while we have such high rates of COVID vaccine in our communities, that we ask everybody to wear a mask, because even if you you've been vaccinated. It's just unknown if you could still transmit the disease to others. What we do know about the vaccines is that they are very effective, 95%, in preventing disease in a person that is preventing that symptomatic disease. So still a lot to know, but good individual protection is what we know about the vaccines right now.
Can I ask a quick follow-up? This might be a selfish question, but when will we know how many vaccines we get in 2021 for the rest of the population, for everybody else?
Well, that is a great question. We are working with the federal government to get clarity on that question. So like I shared, we do not have estimates on our vaccine allocations after January 1st. So a lot more to come, but really obviously a very important piece of information. Either way, we do know it will take many months, probably through the spring and potentially into the early summer before we have enough vaccine for everybody in Washington who wants to be vaccinated.
And I would just add, that's a really difficult thing to predict for a lot of reasons. One is just how quickly can these vaccines be manufactured? There are other vaccines that are in clinical trials as well. When might those clinical trials produce evidence that they are effective and safe and bring those on board? So there are just so many moving pieces to this to answer that question. So the best we're going to be able to do, I think, for some time is really kind of look a few weeks ahead and see what things look like, certainly in the beginning. So we all want to know the answer to that question, but it's a really difficult one to get an answer to, not because people don't want to give it, just the number of variables that aren't known right now.
Our next question comes from Ryan Blutton with the Seattle Times.
Yeah, hi, thank you. So have there been any reports on, are you tracking vaccine wastage at all?
We will be tracking vaccine wastage, but we do not have any information on that yet.
Okay. And then as a follow-up, with now, Pfizer and Moderna now, but as John mentioned, there's a number of others, being developed right now. And so, say we're down the road in the spring and there's 4 or 5 different vaccines out there. How are people going to choose which vaccine they get, or will they get a choice? Will it depend on who your healthcare provider is getting the vaccine from?
Yeah, we don't have a full answer to that question yet, and that really will depend on supply and when other vaccines start coming to the market. What I can say right now for the Pfizer and the Moderna vaccine, if we do see authorization for that, is really the federal government is giving us allocations to that vaccine, to the vaccines, and they're limited. And then we're going to do our best to get those to as many places as we can across the state. So the vaccine that may be available, you may be offered, will be the only choice you have right now as we work towards greater supply. But it will be you're getting to some of the ongoing challenges we're going to face as more vaccines are licensed, and maybe there's more differences than there are between the Pfizer and the Moderna vaccine, which are pretty similar overall. So a lot more to come on this question as we understand what the vaccine landscape looks like later in the spring.
Our next question comes from Allison Grande with Cairo 7.
Hi there. My question was answered, so I'm going to ask one on behalf of Lindsay Sheldon at Cairo. She wants to know if the Illum at-home test, which was recently approved, which doesn't require a prescription and should be about $30, will help relieve the surge on testing sites, and what your thoughts are about that.
I'm getting there. Hello. Good afternoon, everybody. That's a really good question. And I think that having more access to tests that the public can count on as reliable is a good thing. I think that whether or not it will ease slowdowns at testing sites remains to be seen. It's not clear how widely folks will take this up. I think that one of the things that we'll be talking about in the near future is, as more of these tests come to market, how do we both keep track of newly positive cases if possible, but also allow people to test frequently to know whether or not they're putting other people at risk if they have asymptomatic infection. So I think there's more to come on that, but certainly more access is better. We want people to have easy access to testing. And I don't know if Dr. Lindquist wants to add anything from his perspective or not.
Hi, this is Dr. Lindquist. Yeah, I guess my concern is exactly what Charissa said. As people are having the ability to do this test at home, how are they reporting that into our surveillance system? And my concern is we're going to lose track of the true positives and the true negatives as we have more of these home tests being done. And again, the concern, as Charissa outlined, is if people are positive, are they doing everything they can to limit exposure to other folks around them? And how do we ensure that they get as much help as they can? Those are the concerns these kind of tests will bring when you can test at home.
Our next question comes from Margot Maxwell with the Yakima Herald.
Yes, I had a question around when farm workers will be prioritized for the vaccine, when you anticipate that decision coming out. And also, I've been made aware that you did sign a data use agreement for vaccine distribution with the CDC that will sort of revolve around personal information. And I'm wondering what information you'll be collecting and if you'll be collecting any race-related data on people who are vaccinated.
Yeah, great questions. So for the first question on when will farm workers be prioritized, that's part of the information we do not know yet. Part of what we described earlier are the decisions we need to make over the next few weeks. So more information to come, and that decision has not been made yet. The second piece around data sharing with the federal government. So as we know, the federal government is supplying all the vaccine for the entire U.S. for anybody in the U.S. who wants to be vaccinated. One of the pieces of that vaccine and one of the requirements is that facilities administering the vaccine and the state is reporting back to the federal government on what we know about who is getting the vaccine and kind of what's happening with our allocation of vaccine. So how many doses have been used? How many do we still have in inventory? So one of the requirements to do that was a data use agreement, which is a common piece around, how are we sharing data, what privacy protections, and kind of what are the requirements around that. When that first version of the data use agreement came out, we did have concerns because it was not explicit enough within the first draft of the federal agreement about what are the privacy protections around the data. How would the data be used? How is it going to be kept secure? Who would have access to it? Questions like that. So like many states, we had some back and forth with the federal government, with all of our attorneys to kind of get to some answers of that questions. The federal government put out new versions of updated versions of the data use agreement, and also some frequently asked questions that they included as part of the agreement that are really helped alleviate our privacy concerns around the data. The other piece that kind of evolved throughout that conversation is what data does need to be submitted to the federal government. Their ideal case was to get some more identifiable information about who's being vaccinated, and that's different than the type of data we would normally share, which would be aggregate information. So what we did is continue to talk with the federal government about that. And we are able, did get confirmation from the federal government that we're able to submit largely de-identified data. So not names or addresses, but just information on who's getting vaccinated as far as numbers, and like sex of the person, things like that, but not the personally identifiable information like name or address. So that's what happened with the data use agreement.
One moment, folks. I'm having some technical difficulties with Cisco WebEx. Here we go. Our final question comes from Whitney Ward with CREM 2.
Hi, thank you for taking my question. As we are waiting for doses of the vaccine over here in Eastern Washington, my question actually is about this antiviral drug that we are hearing about. Forgive me in advance if I butcher the pronunciation, bamlanivimab, or something along those lines. What we're hearing from doctors here is that it could be a powerful tool in the arsenal here in this region as we're waiting for doses of the vaccine. Is that something that is going to help keep our hospitals from getting overwhelmed over here on this side of the mountains? And what are you telling healthcare providers over here about who should be getting it?
Going to check in with our, yep, thanks, Scott. Scott, your microphone's off.
Yeah, I mean, I'm impressed. You guys asked some of the best and most penetrating questions that are on the forefront for us right now, too. This is actually one of them. There is a process in place in Washington State for any of these monoclonal antibodies or antivirals. There's several of them right now that are brought into the state. They are an advisory committee that distributes them around the state, of which there are several Eastern Washington clinicians that are on that advisory group, including hospitals. And so the goal is to move these equitably throughout the state, of which Eastern Washington would be on equal footing with Western Washington. And the real question is this even comparable to vaccine? And the answer is no. The vaccine obviously prevents disease and is thought to be a more powerful tool, whereas the antivirals or monoclonal antibodies are treatments to try and prevent people to have progression of disease. And so that is certainly a tool that can be used to try and limit hospitalizations. But the real push is to those folks that are yet in the hospital to try and limit their disease in their outpatient settings.
All right. To close out today's briefing, I'd like to turn it over to Dr. John Weisman.
Thanks, Corey. And if folks would just indulge me for a minute or two, given that this is my last weekly briefing with you all, I want to do a couple of thanks. One, I want to thank all of our media and our reporters out there for engaging on this. These weekly press conferences, it sounds like you find are valuable. We find them really helpful to be able to help us to manage our volume of our work, and really count on you all for asking us the important questions that the public wants to know, and so that we can be transparent and give out the information in a way that's helpful, timely, and accurate. So I want to thank you all for joining us on these weekly calls and the other, requests that you put into us. You're an important part of the response to this pandemic, and we appreciate what you do every day. Even if we are sometimes tired and cranky, we still appreciate what you do and really value that. And then I would like to give a shout out to all the public health folks across this state and country who have been working so hard. We've been at this in Washington State, being the first state to have a case that we knew of publicly, 331 days into this response. I am impressed with what our public health workers are doing day in and day out. For all of us who have been, who are kind of tired of this pandemic, whether it's, the need to wear our masks and keep our social distance, our public health staff are amazing and keep coming to this work day in and day out to help assure that the public is protected, has the information they need. Whether it's our staff who are daily putting together the data for us and trying to manage large volumes of data, which, our systems in many cases were never designed to handle a pandemic. Whether it's our staff who are helping to control outbreaks and go to facilities and give technical assistance, the staff who are doing the education of folks and the public campaigns around safety, our comms team who help us put all this together, who interface with you all to make sure that your questions are answered, folks who are working on isolation and quarantine, for helping people safely do that and have a place to isolate and quarantine if they don't have a place where they can safely do that. All the folks out there who are working on testing and trying to get people access to the tests when they need it at the right time. The work around vaccines and that huge lift right now. Our behavioral health colleagues who are helping us monitor the impacts of this pandemic. We know that the pandemic has impacts that go to all facets of health, whether that's our physical health, our emotional health, behavioral health, our financial health. This pandemic has taken a toll on everyone, and we are certainly concerned about that whole piece. And I'm just incredibly impressed with the workers who are showing up every day, constantly working on this. So a huge, huge thank you to my public health colleagues at the local level, state level, national level, internationally. It's an incredible work that they're doing, and it's been a long haul. And then to everybody else out there, our essential workers, the healthcare workers who are the doctors and nurses, and the environmental services people who are cleaning the rooms, and the nutritionists who are bringing in the food to people who are ill and trying to nurse them back to health as well. The pharmacists who are out there mixing the medications and making sure that patients are getting the right services that they need. It takes a whole team, our child care workers, our teachers who are educating folks as best they can at this point in time, our grocery store workers, our hardware folks, everybody who's out there continuing to provide us the retail services we need to make sure that we can continue with our daily lives. It takes all of us. I'm incredibly thankful for that. It's been an honor and a pleasure to serve as the Secretary of Health. It's been the toughest job I've ever had in my life. It's also been the best job, and I get to work with amazing people. So thank you for letting me just express my heartfelt appreciation for everyone, for our tribal partners that we have been working with, as well as sovereign nations. They've been doing amazing work. I will have chances to reflect on this, as I think we all will when we're out of the fray. And I just know that I'm humbled by what people are doing every single day to help keep people health and safety and safe. So thank you for that. And thanks, Corey.
Thank you, Dr. Weisman. And a heartfelt thank you for your and Dr. Alofi's service to Washington State through this pandemic and prior to it as leaders in public health. With that, we will conclude today's COVID-19 update media briefing. We'll see you next week, and you can find this briefing and past briefings available at tdw.org.